Rabies.
Swine flu.
Genital warts.
Broken leg.
Appendicitis.
Colonic irrigation.
Ingrown toenail.
Smear test.
Bitten by a dog. A bit of a headache.
Needing a sick note for 3 weeks.
Nurses.
Torn ligament.
Measles. We have to go to the doctor at some point.
Problem is, you don't always know necessarily whether it's the best place to go, whether you're getting the best treatment, whether that's the right person to actually see.
Yeah, that's right. So if there was a website where you could rate doctors and you could see how other people rated doctors and you could leave feedback for them that would help them improve, that'd be great.
Yeah, because we can do it with books and CDs and lots of other things, but healthcare seems to have missed out on that.
Well, it hasn't. There's a website called IWantGreatCare.org, and we've just completed a 3-week proof of concept with them. We had Microsoft Consulting Services and .NET Solutions for that 3-week proof of concept. So it'd be great if we had a look at that, and we can see how that would solve the problem we've just discussed.
That sounds good.
Let's do that then.
Hi, I'm Mark Bulworth. I'm from DP in the UK and Microsoft. I'm here with Chris Bailey today. Chris, could you tell us a little bit about yourself?
Yeah, I'm Chris Bailey. I work for IWantGreatCare as Director of Technology.
Great. So IWantGreatCare, the website, for those who haven't used it, what is it?
So our website allows people to go on and both add a review of the care they receive from doctors, be that in general practice or in hospitals, and also to see the reviews that other people have added, so that they can then make a decision as to which is the best doctor for them to go and see for the care they need.
And that data is really valuable not only to us as patients, but also to healthcare professionals.
Yeah, indeed. So doctors, healthcare managers, anyone within NHS can then use this data, look at the data that's gathered on our website to help make decisions on providing better healthcare for the public.
Great. So let's talk technical for a bit. What did you build the website in originally?
So the original website was built using the Ruby on Rails model view controller framework and using MySQL Server as our database backend.
Okay, and then we did this proof of concept earlier this year, and that was ASP.NET MVC, SQL Server 2008, I think it was a bit of Silverlight, and integration with SharePoint, which is really important for the National Health Service. So how did you find that ASP.NET MVC compared to Ruby on Rails?
Lots of overlaps, obviously being similar sort of concepts of that model view control setup. Certainly some differences comparing the nature of the Ruby and C# programming languages, but overall quite an easy job to get into the way those frameworks worked and migrating the sort of similar functionality over from Ruby on Rails to ASP.NET.
And what about the database? So SQL Server versus MySQL?
Certainly some big differences, not least in sort of the capabilities of the server, the added functionality, but also because of some of the extra tooling, for example, the integration services part of SQL Server made it very easy for us to take our MySQL database and migrate it over into SQL Server.
And you're using some aspects of SQL Server already in production, is that
yes,
right?
so we've now migrated some of our data over into SQL Server, now using that in our live production environment.
And for the rest of the technology, so ASP.MVC, is that something that's in your plans?
Yeah, so our product roadmap includes a bigger migration over to the Microsoft ASP platform, both for the front end of the website and for back-end services for healthcare provider data.
So the other thing to talk about quickly there is Silverlight, which is something that you presumably hadn't used before. How did you find that?
Yeah, very nice to use actually. Definitely more of a developer's tool, which was very enjoyable for me as a developer to be able to just get in and actually start writing some code that was hooked into both our back end, but then also created a better user experience for people using the IWantGreatCare website.
And so just going back to the kind of the proof of concept results, how did the IWantGreatCare team feel when they saw the outcome of the POC? Really positive outcome for us. Really great to see what we could achieve using a slightly different technology base, the pros and cons of those sort of two different approaches, and certainly gave us a lot to think about in terms of where we can take the product that we've got going forwards. So let's find a GP. We could find a specialist, or we could add a review as well on this website. We'll start off with a GP. There's a number of locations, aren't there?
Yeah, so we've got a database of most of the sort of major towns and cities in the UK to allow people to find what they're looking for.
easier.
Right, so do Milton Keynes in this example, and then when we click search, a good way of displaying that information to people would be to put it on a map, and that's exactly what we're going to do here. What's that red circle?
So the red circle just shows a 5 kilometre radius and the pins are those doctors within that radius.
Oh, that's interesting. And then the sliders on the left-hand side I could use to refine those results.
Yes, or show a larger search or smaller search area.
Right, so let's have a look at this particular doctor's details. That's interesting. So now I can see some reviews.
Yep, so these are reviews that have been added by end users of the website, giving some more information about this doctor, how they thought this doctor was.
They're anonymised, right?
They are indeed, yes.
And the other thing that we could do with this is link into the official NHS site, NHS Choices, and then we could find things like telephone number.
Yes, so the NHS Choices website allows people to see more information about the practice, where it is, opening hours and so on.
Fantastic. So we found a GP in the last example. Now let's review the same GP. So find the GP's details. Here it is. We can check that that's the same one, and then we can review that GP. How do we do that?
Okay, so we start by asking the person who's seen this GP a series of questions and give them some sliders to rate that sort of particular aspect from 1 to 100. So would they trust this doctor? Did that doctor listen to what they had to say? And would you recommend this doctor to another person?
We saw when the reviews that the comments were anonymised, but here we're entering an email address. Why is that?
So we do that to validate the review, to make sure it's from a real person, so we have an email feedback loop to ensure it's a real email address, and once they click a link in that email, then the review will go live on the website.
Okay, so it's kind of to stop the system from being abused.
That's correct.
And then here I see that we can rate as different relationships, so I can be the patient, but equally I could have been the carer of the person.
Yes, so this is to allow, for example, a parent who's been to see this GP with a child to add a review, or even for colleagues to add reviews of their...
So your typing is very fast, Chris.
Yes, well, so years of practice.
And now the location here, it says, would you like to comment on the location? That means what?
So in this case, this would be the GP surgery, the GP practice where they were seen. As before, series of sliders where people can rate a number of aspects about whether the surgery was clean, whether they dealt with efficiently, were the staff caring, were the nursing staff that they may have seen, were they treated well by them, and was the experience that they were treated with dignity and respect.
Kind of quick technical point. A lot of that UI that you've seen there, that was silver, is that
yes,
right?
Yeah, indeed. Sort of adding a sort of enhanced user experience to users.
Great. We've looked at the IWantGreatCare website from a patient's point of view, but that data is going to be really useful to doctors and healthcare providers. So let's log in as the member of a healthcare trust. In this instance, Milton Keynes Primary Care Trust, and what can I see?
So instantly, when you log on, you can see an overview of the data collected for all the doctors within the Milton Keynes Primary Care Trust region. And that data, as you can hopefully tell, is the same information, the same metrics that we collect from patients when they leave their feedback.
Because it's a proof of concept, it's worth saying that this data is fictionalised data, right?
Yeah, it's totally made up.
The other thing we can do now then is to go into more detail.
Yeah. So once you've seen this overview information and the way that they've trended over time versus the national average, then we can start drilling down into more information.
So we can start to see what's behind those numbers, what makes up those kind of trends that we can see. Oh, that's interesting. So now we can see a bunch of hospitals and care centres and so forth. What are those interesting lines?
So this is the spark lines, as they're called, are just a quick and simple overview of the scores for practice over time, sort of on a per practice basis, as they're displayed here.
All right, so it's like a little snapshot of the current trend.
Yes.
And then we can go into even more detail for Central Milton Keynes Medical. Now what can we see?
So again, going down into another level of detail here, seeing the trending for individual doctors, as how their scores are changing over time, and then also some overview information about this location, those sort of same 8 scores out of 100, this time compared not only against the national average but also other practices in the location within this same within that primary care trust.
Okay, then for an individual doctor, and this is the one that we picked previously, we can see the verbatim comments that patients have made. That's interesting. But if I put some data in, she can see what I've written?
Yes, but not who wrote it, so
okay.
It is totally anonymous. But again, gives more information to the primary care trust. They can see what was the sort of the raw information behind those scores.
Right, so you can see and understand why people are coming to the conclusions that they're coming to.
Yes.